1:14. Okay. He's got some great guest speakers for you. And then Mrs. Myers, who helped out in the success courses this past few weeks, teaching career options. It was a great session, and we thought we would have Mrs. Myers do that for the balance of the students. So she's going to be discussing career options. Some miscellaneous profiles that I need as soon as possible. Don, you're working on yours, and know that. Can you give me some kind of a draft back? Because we're going to have more than one revision. Can you give me some kind of a draft back this week? Okay, the sooner the better. Logan, are you working on yours? I'm sorry? Okay. Can you get that into me? All right. Ty? Handing it to me personally. Thank you. Natasha, can you get it to me this week? Okay. Where's Aiden? Aiden here? No? Okay. Those are important. Those profiles are going off to somebody in a couple of weeks. And we need to, Mrs. Myers needs them to go in, and we want to get those done right away. For the healthcare, Mackenzie, I have yours, right? Chelsea, I have yours, correct? Caitlin, have you done a profile? Would you check when you get home and let me know? And just resend it to me just in case, because I went in my files, I didn't see one for you, but doesn't mean we don't have it, okay? If you wouldn't mind. Okay, how's everybody's laptops doing? Any issue? We got a round of applause. Any issues that we need to know about, that Mrs. Bruner needs to know about? Speak now. No? Who, where? Yes?
I think they are going to be updated.
Okay, so it's my understanding they're updating like a dozen or 14 right now. Mrs. Bruner's going to take those updated computers, swap them out with some of yours, update those, and complete the process. So I'm hoping by the first of the year they'll all be updated. All right? Is that something we're going to have to do annually? I mean, right. Okay. So watch out for viruses, any flags, get to Mrs. Bruner right away. Okay? And then Mrs. Bruner, do you know when we'll have those back? The first round? After Thanksgiving? Okay. And then, was I right, you'll put those in and you'll take 12 or 14 new ones, and then you'll put those in and take the other ones back. Okay. If we can make sure Dr. Donovan knows that it's important to get those done right away, maybe she can move that up a little bit. I'd like to get all of them updated before the end of the year. Was there any other profiles that you were looking for? Got Tom. Tom's going to give me, we worked on the first revision. He's going to give me his second revision this week. Yeah, make sure I get a copy of those, okay? Okay, let's talk about the last seminar, the reflection. So we had Daniel, Daniel was our guest speaker, and what did you got your notes out? Good, good. What are some of the important points that Daniel was making in September? Jamisha?
Money management as well as time management.
Money management and time management are the key to success. Those are two pretty good ones. Tayshawn?
He said that you should apply before holidays, specifically December 15th, and receive letters of recommendation early with when you apply.
Okay, apply early prior to December 15th was his recommendation. Jacob?
I like that he listed some of the scholarships for some of us who haven't looked at scholarships yet. He listed some specific ones that we could apply for.
Right. He listed the scholarships. Has that, when do you plan on posting that video?
I can do it.
Can you do it this week?
Yeah, for sure.
Okay, because somebody who didn't take all the notes may want to go back and look at the schools he recommended. So we'll have that video posted this week. Mackenzie?
He said make sure it's
Right. What do you think makes you stand out from other students and highlight that? Yes, Jim. Folder for each school to keep organized. Excellent. I mean, doesn't take much, right? If you apply to 10 schools, you got 10 different folders. Just be dropping everything in. You have a little checklist on each one of the folders. Yes. Make a funding spreadsheet for each school that you apply to. Very important. Very important. Yes, Ty.
That some schools are willing to match offers from competing schools before doing W2.
Right. Some schools will match offers from other schools. So if you're in early and you have the opportunity to get offers earlier, then you have time to negotiate. That's a good thing. Yes, Tom. Apply for as many colleges as you can. Again, if the application process is somewhat of an issue, either from funding or whatever, please get with Mrs. Bruno or Mr. Bruno right away, and we'll help you figure it out. But definitely apply to as many schools as you can. Amal? Yes?
Somebody already said start a spreadsheet for each school.
Yes. We got that one. I think we're going to recommend, I think Mr. Bruner is strongly going to recommend that all juniors try to take the ACTs before they break for summer next year. Before you break for summer, at least take it once. Get the feel for it. Have it. There will be more kinds of Infinite Scholars programs coming up. And with those things, when school starts in the fall, they'll need some kind of ACT score. So you might as well get ahead of the curve, take them then, okay? Again, if there's any issues with timing, funding, whatever, please get with Mr. and Mrs. Bruner, and we'll work it out. But that at a minimum should be your target. Take it at least once before the summer. Okay. So Tabitha, we have a session in November, correct? And the date of that is 15th. And then we have our holiday celebration, and that's December 13th. That holiday celebration is from, is it 3 to 6? 3 to 6. Okay, Mrs. Bruner will send out an invitation to you and your family. And if you would be so kind as to get a head count back to her as soon as you can, all right? I'm sorry? December 13th. Bless you.
Thank you.
We have a terrific guest speaker lined up, and then we're going to have just a fun time and a lot of good food, right, Mrs. V? Yes. Okay, we're working on it. No? Okay, maybe Papa Test. It'll be good food, trust me. Other than a guest speaker, we won't have a session that day, so it'll be just a lot of celebration, okay? For a great year. Just to give you an update, you know, when the graduates go off to school, camp shrinks for a couple of months. But Mrs. Bruner and I, and Mr. Bruner, we have this down to a science. So in February, we'll be interviewing, filling out our sophomore class. So right now I think we have 5 sophomores. We'll be filling out our sophomore class, which means at least 10 more sophomores. We'll be bringing in 5 freshmen, like we did last year, so that the top 5 freshmen get exposed early. And we may fill in 1 or 2 juniors or seniors. But quickly in March, you'll see this group go from 30 to 32 to like 45. And then the summer will come, and the seniors will be around till August, and then we'll drop back down. So don't get nervous. It's the natural flow of things in the camp organization. Friends that you have that you think would fit into camp nicely, please tell them about camp. They'll have an opportunity to get on the list to interview, and Mrs. Bruner will be getting that word out probably in January. All right, but this is an early posting. How many of you plan in the next, let's do the next 9, let's do by May. Okay, so by May, by the time you get out of school, how many of you are planning on taking driver's education? Okay, Mrs. Bruner, can you write these names down, please? Jamisha, Logan, Taishana. Courtney, did you have your hand up? I got you, Jamisha. I've got Caitlin, I got Jada, and Donna. Okay? So, do I have everybody who wants to take it? Not that are only planning, but that wants to take it? Okay, there's nobody else that wants to take it, but for some reason can't. Okay. All right. Just a couple more things before we break out. And it's kind of been on my mind because we've had 1 or 2 students leave the program, and they gave some rationale why they were leaving, and it didn't make sense to me, but I wanted to see what you guys felt. So, the question of the day is, what is camp to you? What does it mean to you? Anybody? Jamisha.
Well, to me, I feel like camp is like one of the most amazing things that we had at early college. Like, when my brother was in camp before, all I wanted to do was be in camp, then I finally got into it. It's just a wonderful opportunity because it opens up so many more doors that wouldn't have been open to me if I wasn't in camp. So the people that left, I don't see what the reason was, because it can only help you, so I don't see why you would leave.
It's a convenient way to make sure that I'm still being on task and on point with what I'm gonna do after high school. It's like a gateway to taking your ACTs, getting into colleges, because it's connections. You need networking when you're out of high school. It's not like you have people to guide you there, but this is that guide like to help us when we leave and while we're here.
Somebody else with that?
I think camp is just a head start on your careers and different opportunities, and like when you grow up, I think that's really important.
Miss Jada.
To go along with what they have already stated, camp is also like a support supportive program to where you get support from work, personal problems if you have any. We're supported at our games by Mr. and Mrs. Bruner. They were there Friday night. It's just a wonderful program to me to be a part of that A, puts you on the right career path, B, helps you out with those career paths and will guide you on choosing which paths will benefit you in your future.
Anybody else? Anyone else? Okay, so I wrote down a couple of things, and we heard some of them. Networking, mentoring, we heard that. Skill development. We're learning a lot about skills in the success classes, but it's constant skill development. Okay. Resumes, profiles. We have apprenticeships. We help with colleges and careers. We'll hear career options today. And also, you're going to see healthcare today. Next month, I think Mr. Larocca is back with some more engineering. And so we expose you to a whole bunch of different careers. It's constant training and development. It's leadership and financials. Starting in January, February, Mr. Savodio will be talking to you about managing your finances and controlling debt, okay? Which came out of that panel discussion. So he's going to talk to you all about student loans. We're going to talk to you about, so we're going to fold in what we did before, which was Finance 101, fold it all together and include student loans and debt, and how do you manage that, okay? So I'm looking forward to that. But, and here's something else that camp is, okay? So for employment, right now we have jobs in the Timken Corporation, Goodyear, Freshmark, Glenmore, Habitat, Smuckers. Okay, and it's growing every year. The jobs are in engineering, finance, accounting, IT, operations, sales, nonprofit, and the jobs that we're unfolding in the next 9 months should be in healthcare, early childhood, education, and potentially legal. Now, Judge, you just heard a whole bunch of benefits and opportunities within the program. And you come into the program because you've, number one, been recommended, and the work you've done at the Early College High School with Mr. Bruner is terrific. You get through an interview, and you're accepted into the program. But everything else beyond that will teach you everything. You can continue to come to the sessions. We want to do career training. You're all eligible for profiles. Every one of you are eligible for a majority of those things. But what I want to make it clear is when you join camp, we don't, as part of the program, it's not guaranteed that every single one of you will get an apprenticeship, a job, and so on and so forth. You have to want it. You have to show us that this is what you want. You have to come after Mrs. Bruner and I and Dr. King and Mrs. Myers and Mr. Drennan and whoever else that we expose you to over a cycle of a couple of years. I mean, think about it. We're bringing you in minimally at a sophomore. You got a couple of years. We're developing you. We're watching you all the time. When I send emails and I don't get responses, it tells me something. When I get responses right away, depending on how those responses are, it speaks volumes. When we ask you to do something like profiles, I get a wide variety of people who get it back right away, people who get it back, it looks like they haven't put any time into it. Then I don't care how many revisions there are, as long as we get it right at the end, but it's the whole process from the beginning to the end. If it's very, very difficult and you make it very, very difficult to get there, that has an impression that tells me things. Your attendance here tells me things. If you're tardy, if you're late, or you're on time, tells me things. I mean, all of those are things that tell me, do you want, you know, what's at the end of the camp session, which is the ultimate, get the on-the-job apprenticeships paid, take your networking to the next level, and really set you up, okay? But that's the other thing, Mr. Bruner and I, and Mr. Bruner, when the seniors were going off, they were almost disappointed, some of them, because we didn't hand them employment. And that's not what it's all about. We probably have more jobs than students who really want it, so you have to come after it. You have to show us that getting into the program and what we offer is a benefit to all of you, except when it comes to the ultimate, which is the apprenticeships, which really sets you apart from anybody else. So, does anybody have any questions about that? Because I want to make sure. There's many, many things in this program that you're entitled to, probably 90% of everything I said in there. But then there's this other percentage that you gotta want it, and you gotta want it bad, and you gotta kind of almost bug us. I mean, when you see us walking around the school, you see me walking, you need something, come after me. Some of you do it extremely well, okay? And some of you, I just see you on a monthly basis, and we don't have a whole lot of discussions. Mrs. Bruner and I will give you all opportunities to come and sit with us one-on-one. We ask you questions about, you know, what your goals are. We talk about your majors. Have you considered some options? We'll go through all of that. But know that we're looking for you to tell us we really want this. Do I have a veterinarian job today? No. But if you come after us and you are that passionate and you want it, I will do my damnedest to provide a veterinarian opportunity, okay? And we have connections. So, but I'm not gonna go create a veterinarian opportunity without having a student who really wants it. Because again, I have more opportunities than I have students, but, so does it make sense? Is there any questions about anything I said? Okay. We want to help every single person in this room. My operating committee is committed to it. That's why they're here. And I can go on and on and on about their commitments and everything. Mrs. Myers came in on a plane yesterday, and here she is today, you know, doing this. And before she left, we were interviewing. By the way, Mrs. Myers heads up what we call the Tech Camp program, and we just put on 25 new students from technical camp. So, yeah, I can't thank her enough. It'll be an extension of this program, and it'll be for those students who are not as focused as you are on a four-year degree and should be looking at technical job support. And again, she probably has more jobs than we have students, okay? And it's everything from oil and gas to welding to electricians to automotives, and it spans the whole gamut of technical jobs. So that's going to grow, and that's something we need to do. But again, none of those students that are in her group are entitled to anything other than, here's the basic structure of our program, now tell me that you want this, and go after it. And then we'll help you get it. Okay, with that, Mrs. Bruder, you have anything for the group? No? She's pooped. You guys had a party last night? Yeah, look, you're all pooped. All right. I heard there was some wild dancing going on. Ty, were you dancing last night? Of course. DK was dancing. No? DK's dancing in a lunch for a moment the other day. Are you kidding me? Can't stop it. He's got happy feet. All right. With that, let's do this too from now on. If you go to a breakout session, what I expect is you'll take your binder with you, okay? If the breakout session is here, obviously you stay here. If you're going like with Dr. King, take your binders with you because you should be taking notes in Dr. King's session. When you're done, bring your binders and please put them back right in here. That would help us out tremendously. And then you students who are staying here, same thing. Close up your binders, bring them over there, okay? Because they spent a lot of time, they've been here since 12 o'clock this afternoon, getting the seating set up, getting the refreshments set up, getting your books set up. We don't need to spend another hour, afterwards cleaning up. So if you wouldn't mind, we'll pull those right up over here and you could just put them in there neatly, okay? Does that help? Especially today, because we're all tired. All right, with that, Dr. King, anything? Okay, healthcare students. If you would follow Dr. King. And career option students, stay here. And as a matter of fact, if you wouldn't mind moving up.
Two presentations here. The first one is on in-hospital pharmacy, and the second one is retail pharmacy. We have some very, very experienced people here. The first one is Steve Armitage, a good friend of mine to the left that I have pulled out of retirement. He retired a couple of years ago, director of pharmacy at Altman Hospital. He started at Toledo in '76 when he got his BS, and then he, from '07 to '13, he was at Altman Hospital. 76 to 78, he started out at Cleveland Clinic. 78, 88, he was at Timken Mercy as assistant director. 88 to 96, assistant director. 96 to 98, director of Owens Healthcare. At 98 to 07, director of pharmacy at Mercy. And from 07 to 13, director of pharmacy at Altman Hospital. And he's been on tons of committees. He's a past president of the Akron Area Hospital Pharmacists Association. He's been on 30 or 50 committees, but the one that caught my eye, he was on the pneumatic tube task force, which I thought was kind of an interesting.
I'll explain you what it is.
Yeah. Anyway, also I asked about 40, but I have maybe 14 of these Neomed for either medicine or pharmacy. And the people at pharmacy are particularly interested in picking up students in pharmacy. And I'll leave you now with Steve Armitage, who will give you a good picture of in-hospital pharmacy.
Thank you and welcome. And thank you, Dr. King, for asking me to come here today. It's a pleasure. Sunday afternoon. I'm sure you all had better things to do today. How did you pick Sunday to come? We didn't pick.
Well, we didn't really pick.
You had no choice. Well, I'm glad to see this because that tells me you're really motivated, really committed, and you don't care what day of the week it is to come here and be with us. I just want to start by saying that pharmacy is a great profession. I've been in the pharmacy for about 40 years. I just retired 2 years ago, and I'm only doing it about 10% now, doing a little bit of consulting in pharmacy, and I'm enjoying doing it. What I do now, just go around and advise physician practices of how to meet the regulatory requirements. And there's quite a few requirements when it comes to pharmacy. It's a profession that's regulated by the FDA, Food Drug Administration, by the Ohio Board State of Pharmacy, by the Drug Enforcement Administration, by the EPA, by OSHA, by just about anyone. Even the drugs that we throw down the toilet or in the trash, they have to be regulated how they're going to be disposed. And actually, there's more new regulations that come all the time. My main responsibilities over the years have been with hospital pharmacy, and that's a little bit different, not very much different than retail. Pharmacists do about the same thing, or we used to do about the same thing as retail pharmacists many years ago, but all that has changed now. Hospital pharmacists now have robots in place that do most of the dispensing. Believe it or not, when pharmacists get an order, that directly goes to the robot, and all they have to do is verify that the medications that were prescribed are appropriate for the patient, appropriate for the condition, the appropriate dose form and dosing, and also that they will not cause any drug-drug interactions, any major side effects, or any major problems for the patient. In addition to that, now pharmacists spend more time because of robotics and because of pharmacy technicians. And there is about 360,000 pharmacy technicians all over the country right now. There's about 260,000 pharmacists. I just looked that up today at the labor statistics site, and it's on your handouts. And I will very much recommend that you really take the time. Do you all have access to the internet? If you don't, go to the library and bring that site up. That will give you all the different professions in healthcare, not just pharmacy or pharmacy technicians. You want to do your homework, you want to research to make sure that whatever you get into when it comes to healthcare is the right thing for you. Pharmacy may not be the right thing, but however, you have great opportunities in healthcare. Healthcare is growing at a 20% pace a year. There's many jobs that are opening up all over the place.
Which website is that, Steve?
That's www.bls.gov/OOH healthcare/home.htm. Okay.
You got it on there?
It's on here.
Okay.
On this handout, if you go there, you will find all the professions in healthcare listed. And if you click on each profession, we'll tell you how do you become that professional, the requirements, the schools that are available. It gives you statistics.
We have extra handouts in that because us three we didn't get those.
I can give mine. Oh, here. Got it? Anybody? Right on top, and I also have it at the bottom. If you look at that, it pretty much tells you about, let's start with pharmacy technicians. It tells you a little bit about pharmacy technicians and the educational requirements and the certification requirements. It also tells you about the work environment. It tells you how to become a pharmacy technician, what the pay is like, and right now the pay averages for pharmacy technicians are around $29,000 a year. And that's growing because it is a growing field. It may not sound like a lot, but it is a growing field, and it's getting better and better. And there is also a 20% growth trend for pharmacy technicians all over the country right now. And Paul will probably, Mr. White will explain later the growth potential of pharmacy technicians in the Stark County area and how much in demand they are. The pharmacies, the demand is going down somewhat the last few years. So I'm not here to mislead you. However, the national statistics show that there is a trend of 20% growth even in pharmacies in the next 10 years. And why? Because pharmacists now do more and more things, hospital pharmacists do more and more things than what they used to do 10 and 20 years ago. So they get involved more in direct patient care. They do reconciliations when the patient comes into the emergency room, or when the patient gets admitted in the hospital. They take the medication history and they get help from pharmacy technicians as well. They look at every medication the patient is on. They make sure that it's appropriate strength, the patient has been taken it appropriately at home, and it is safe and effective for that patient. If they detect that there is a problem, they call the doctor. And they discuss that problem with the doctor. They say, "Doc, looks like this patient is on 2 different medications that can interfere with each other, can interact with each other, can cause low blood pressure, can cause dizziness, can cause problems. Can we change it to something different?" And usually the pharmacists know enough about the different classes of medications and the different medications to recommend a safer alternative. Some other times medications that patients are on cost too much. Believe it or not, there's people out there cannot afford their medications. You know, they're very expensive. So pharmacists make recommendations for cost-effective alternatives. Drugs that will do exactly the same thing, sometimes safer, that would cost half as much, or 1/5 as much, or 1/3 as much. And that's what having the knowledge and the ability to do that as pharmacists can make a difference in the outcomes, in the healthcare outcomes, not only in improving the health of patients, but also reducing the costs, making them more affordable. So again, reconciliation, that's what they do with medication review, but then they're also responsible to review the order itself in the computer system to make sure that, again, everything is okay before they send it, before they verify it, and that order then is sent to the pharmacy technicians where they fill and dispense the medications under the direct supervision of the pharmacist. Many drugs in the hospitals are not really in the form of pills, tablets, or capsules. They're intravenous medications. Those are the type that they go directly in your bloodstream. And they have to be made under strict sterile conditions. They have to be USP, United States Pharmacopoeia certified. They have to be certified by the FDA, and everything has to be done right and made safely before it reaches the patient. You might have heard the last couple of years on the news where some compounding pharmacists got in trouble because of some medications they made that were supposed to be sterile, were given to patients, and patients got infected and died. Those are the kind of things that can go wrong, and it really makes the role of the pharmacist and the pharmacist more important to safeguard the safety of the patient, to make sure the drugs are used safely. Now, there's also specialties in the pharmacies. They round with physicians in the different specialties in psychology, internal medicine, gastroenterology, cancer. For every specialty now, every medical specialty, there is a pharmacy specialty as well. It's not unusual to see pharmacists around with all the different specialists, physician specialists in the hospitals, along with the nurses. They're on the team, they make decisions. The pharmacists are there to review the medications that they're being prescribed, the patients are being prescribed, to make sure again that they're appropriate, they're safe and effective. And the other big function pharmacists nowadays that are really involved into that, they weren't so much before involved, and was direct patient education. They spend a lot of time, and I'm talking about Mercy and Oakland now, but that's a trend all over the country. They spend quite a bit of time now. We have a pharmacist on every floor, and they meet with every patient and the family oftentimes if the patient cannot understand. They meet with the family and the patient. They explain to them all the medications that the patient will be discharged from, will be going home. Again, they tell them what the medications do, how to take them, when to take them, what to watch out for, potential drug-drug interaction, side effects, and other things that if they do happen to immediately report back to the hospital or to their physician. So, and that, if you look at statistics, large number of the hospital admissions are due to side effects and drug-drug interactions, things that happen with medications. Either patients fail to take them, or take too much, or what they take is not the best drug for them to take. So that's basically what happens. There's a lot of involvement in total therapy management also as well, and maybe Brad will talk a little bit about that, what they do in the retail side. But even in the hospital setting right now, we do have pharmacists that follow up, they call patients at home, and they coordinate the things that the patient should be doing to be taking this medication safely. Now, having said all that, those are expanding roles for the pharmacists, okay? And they continue to grow, and the responsibilities continue to grow, and there's an effort to make pharmacists providers right now. Not all states allow that. The pharmacists cannot bill for their services. That is the problem. The hospital has to absorb the cost of the services. Now, on the retail side, I'm not sure what's really done there, but probably Paul will tell you that it's the same issue we're faced with in retail, that there is no reimbursement, no good reimbursement for pharmacists to provide cognitive or educational services to the patient. But we're doing it because it's part of our job, part of the profession to do that. Now, you might ask me, what does it take to really become a pharmacist? And really, that's why I want to give you a motivational speech to a little bit inspire you. You're young, you're all young, you have great opportunity in your lives, and the opportunity starts now. You're what, sophomores, juniors?
Seniors.
This is it, and I'm here to tell you today about time management. It's so critical and important. I'm so happy to see you here on a Sunday afternoon. You could be out playing, I guess, but time management is very, very important of how you're going to set the groundwork right now for the future. You've got to learn at least one thing every day. If you learn one thing every day, in 365 days, you're going to know how many things. You're going to know 365 things. That's a lot. Isn't it a lot, 365 things? Well, take that, multiply it by 5 or 10 years or 3 years, and this is the opportunity to really learn things well. And you're going to do that by taking a little bit of your time, maybe a couple hours a day, to learn something new, something relevant that's going to help you in your future. But whatever you learn it well. And know it. It doesn't help just to read something and say, okay, I know about it. Learn it well, know how it works. And this is a time to really focus more on the opportunities for your future, what you're going to be doing 5, 10 years from now. You don't want to look back 10 years from now and say, I wish I had studied more. I wish I had done this, or I wish I had done that. Don't have any regrets. You don't want to have any regrets later, because unfortunately, as time goes on, time is lost. It's hard to regain that momentum. It's hard to be able to pick up where you left off and continue at that point. So here's your opportunity. Take examples from the people that have passion, the people that are motivated around you, the people that are positive, that have positive attitude. Let them be your role models. And if you have friends that are not positive, that are lazy, that never want to do anything, try to motivate them and don't really let them drag you down. It's so important as you move on with your lives and as you move on to decide on a career, passion. You got to have passion. And you got to be confident about what you want to do, but you got to do your homework. And again, I'm not here to tell you pharmacy is the greatest profession that there is, because that might not be the greatest profession for you. It probably is a great profession. I would do it again if I had the opportunity, but it's also nice to have all your options open. Not all of us can be pharmacists. Not all of us can be pharmacy technicians. But some of us can be doctors, we can be architects, we can be whatever it is that we want to be. I think it's important for you to realize that time management is everything. I'll tell you a little bit about a personal story here, and I'll probably finish. I was born in Greece, and you probably wonder where my accent is coming from. And I came to the United States when I was 15 years old. I had nothing. I had, just like you see me now, that's the only thing I had. I only had one pair of shoes. Guess what? I didn't know the language. I did not speak a word of English. Maybe I knew good morning or one thing. I arrived in New York on Columbus Day. Well, I think it was on October 12, 1967. And some friends drove me back to Canton, Ohio, and they had made arrangements for me to go to McKinley High School the very next day. McKinley High School. We arrived in Canton at 4 in the morning. 7 o'clock, they told me I gotta get up and walk to McKinley High School. So anyways, I had no choice. I said, okay. I was bummed out, I was really sleepy. They came and got me. They threw me, my very first class was an English literature class. It started at 8 o'clock in the morning.
How old were you?
I was 15 and a half. 15 and a half. They threw me in a junior class with the juniors. So it was it was an English literature class. I went there, they introduced me, and there was a kid that spoke Greek and was interpreting for me. But he had to go to another class. He left me in that class. Everyone was talking to me. I didn't know what they were talking. I had no clue what was going on, what everybody was talking about. So I sat down, and having not had any sleep for the last couple of days, coming over and driving over from New York, I just tried to keep my eyes open. I couldn't do it. 10 minutes later, I put my head down on the desk, and I must have been snoring really loud, when that happened, because the teacher came and shook me a little bit. She started telling me things. I had no clue again what she was talking about. So they go and bring the interpreter over to figure out what's going on, So I said, what are they saying? And he told me, well, he says, in the United States, in this country, students are not allowed to sleep in the classroom. Well, and needless to say, I probably ended up in the principal's office my very first day, so I got over that. But I can tell you, I was poor. I was dirt poor, and I'm not really ashamed to say that when I came to the United States. We didn't have anything. And I had to make some choices. I didn't want to live the rest of my life in that condition. I used to go home from school and cry. I didn't know the language, didn't know how to handle, but I used to lock myself up in a room and write each word down in the English dictionary about 50 times. I started with the A's and I went all the way to the W's. It took me probably 2-3 months to be able to communicate a little bit, but not a lot. And I was able to make it through high school because I did apply myself. And in college, I had a slow start because of the language, but then after I got more comfortable with the language, I did well, Well, I think most of you are in better shape than I was. That's what I'm trying to tell you here. You have opportunities here. All you have to do is take advantage of those opportunities. Life does not matter how poor you are, how rich you are. It's how well you're going to apply yourself in moving forward. And again, you want to look back and say, I'm glad I did what I did 10 years ago. with that, again, I gave you a lot of information about how to become a pharmacist and what pharmacists do. And in a hospital setting, you can read about it. I could talk to you all day about it, but we really don't have that kind of time. I will leave that up to you. But I'm available. You guys wanna look me up, Steve Armitage, I'll even give you my cell phone. Call me if you need advice. 330-327-3995. I'm available. If I can be your mentor or anything you need help with in life, I'll be there to help you cope with everything that you need.
Thank you, Steve. Do you have any questions for Steve?
Yes.
What did you say your last name was?
Armatas, A-R-M-A-T-A-S. Some people call me Armatas.
I have two comments for the students. One is that when you have your academic record recorded, it is recorded, and it stays there forever. So don't think you can goof off here and there and then rev it up when you get into college, because those records are permanent. Some people think they can goof off for a couple of years in college and pick it up their junior and senior. It doesn't work that way. That record is there. The other comment I have is I read 3 or 4 time management books, and now with iPhones, of course, it's easier, but there's still some good books on time management, and that helped me immensely. You can become much more productive. So I would recommend that you look at those.
And another thing I want to add about time management, I'm saying have fun, enjoy yourself, but you're going to have more fun if you do your homework first. And now it's Saturday, and everything is done, and you can go out and have some fun with your friends. However, if you haven't time managed yourself well, it's going to be Saturday, your friends will be out, and then you're going to say, well, I haven't done my homework. So be proactive and get that done. And again, just to add to what Dr. King said, criminal record in pharmacy is a no-no. No drugs, no arrests, any of that. If you have any of that, you're doomed right from the beginning, because you're not going to get accepted in the pharmacy school. And if you are accepted, even in a technical technical school or pharmacy school, and you get in trouble with drugs and probably kicked out, or the State Board of Pharmacy will never license you. And if you make it as far as becoming a pharmacist, and all of a sudden you do drugs or you get into drugs, not only are you going to get in trouble, but you're going to lose your license forever, so everything will be lost.
Okay.
Thank you.
Now we have Paul White and Brad White, his son, who will give you some detailed information about retail pharmacy. I want to give you their background a little bit. Paul graduated from Ohio Northern in 1966. He's the owner of Medicine Center Pharmacies in the Canton area. And he does a lot of educating and does a lot of teaching for patient care in the public. He hosts an hour-long health-related talk show, Health Matters, with Medicine Center Pharmacy on News Talk, WHBC 1480. Is that once a week?
It is on Friday mornings at 9-10 a.m. for an hour, roughly an hour. Yes.
Okay. And he does that with his son, Brad. He's president of the Canton Rotary, where he received the 2012 Rotarian of the Year Award. He's president of the Chain Drug Marketing Association, where he also received the Member of the Year Award in 2011. Paul was selected by the American Pharmacy Association as a leader in pharmacy and was sponsored by the Wharton School of Business at the University of Pennsylvania for their executive development program. He's also spoken before the prestigious industry conference on unit dose packaging in Philadelphia, as well as in Cologne, Germany. He has served with numerous civic and professional groups, including Juvenile Diabetes Research Foundation, American Cancer Society, American and Ohio Pharmacists Association, and the National Community Pharmacists Association. His son, Brad, is a graduate of Purdue. He's vice president of the company, as well as managing pharmacist of the Medicine Center Pharmacy in New Philly, Ohio. He serves on the Ohio Pharmacists Association Compounding Board and the Medicine Center in New Philly achieve accreditation. And it was only the second pharmacy in the state of Ohio to achieve accreditation in compounding. So with that, I'll turn it over to Paul and Brad.
We, of course, have a totally different slant on pharmacy than Steve does, and he's been around not as long as me. I will be a 50-year pharmacist next year, which is an accomplishment in itself, I think, to get there. And of course, Brad, when we opened our first store in 1976, was 3. So we had some pretty big struggles in that first year or two. When we opened our first store, it's right down the street in front of Alton Hospital. But we made it through all of that, and in the course of my 49 years, as Steve probably has alluded to in a different way, has changed dramatically. And we now give flu shots, pneumonia shots, and there is a whole level of expansion, whooping cough, all those other things that, of course, I don't think either of us ever expected was going to drift into the retail pharmacy organizations. So, a little background on the company. We do actually have 5 pharmacies. We have one in Canton, one in New Philadelphia, one in Minerva, and our Louisville operation has a retail pharmacy in the front and a long-term care pharmacy in the rear. And long-term, of course, being nursing homes and group homes and things along that line. And we do embrace automation, robotics, just as the hospitals have. Brad's store and one of our other stores has counting cell technology that counts the meds, puts it in a bottle, puts a cap on the bottle, puts a label on the bottle, and it comes out the chute. And the pharmacist at that time then examines it, makes sure it's the proper item. Now it doesn't handle all of our meds because of inventory issues. It would be foolish to load all the cells with expensive drugs and have them sit there for days or whatever on end and not be used. So about 50%, am I correct in that, Brad? About 50% of our drugs are in the robotic units, okay? And we also have a discount store which we own next to our, got the name tag here somewhere, in Louisville called Everything Half Off, where we originally started that business with closeout merchandise, and we now are in closeout merchandise. We now belong to True Value Hardware in that business, and we recently bought about 5,000 wristwatches from closeout. So if you need a wristwatch, we'll make a deal. And we have everything imaginable in the wristwatch from Rolex. So that's kind of the picture of our company. And as a pharmacist, there's never really been a moment where I've not enjoyed what I did, what I do. You get these daily events where maybe too many employees call off sick, and you got to run the place with yourself and two other people instead of 4. You have the usual aggravation with the customer who thinks the medication costs too much, or it takes you too long to fill a prescription, or on and on. I can name you a million things why they would complain, okay? But for 90%, 95% of the time, you're a very highly respected, pharmacists are a very highly respected member of the community. They trust you. They trust they trust your advice. And one of the things that has happened when I was a kid and growing up, I pretty much knew how to take care of myself. What kind of medicine, cough syrup, whatever to buy, or cough, cold, nasal sprays, vaporize, whatever you needed. People in general now, adult people in general, do not really know how to take care of themselves. And so they do come to you for product recommendations. And here's where part of the problem comes in, is that the meds today are extremely complex. And they affect your liver, and they affect your kidneys and whatever. If you throw other medications on top of those prescription drugs that you're taking, there can sometimes be some pretty serious issues. So this is kind of where the pharmacist steps into play. patients can't always get to their doctor. Doctors are busy and getting busier and busier because of federal requirements. So it's very difficult to call your doctor and have a chat with your doctor. We're free. You walk into the pharmacy and ask questions. We're going to answer your questions. And in the case of our company, we are basically most of the time overstaffed with pharmacists. We have 14 pharmacists for 5 locations. And we always have 2 or more in every one of our stores, with the exception of our slower store in Minerva. And in the case of Brad's store, the complexity of his operation with compounding, retail services, they also do eBay for excess merchandise, and they also have a sales website called PhillyPharmacy.com. And if you want to look at us and see some of the things that we are doing and what our stores look like, you can go to MedShopRx.com. And we do have a website. Our radio programs, every one that we've ever done, we're over, I think, 150 now. You know about right?
Yeah.
We've been on the air for over 3 years. We've had every doctor practicing in the community, but retired Dr. King over here in the program. We should maybe talk about it.
Well, what's that, I haven't done much?
No, we haven't had you on our radio program.
Oh. Well, I love to talk.
We got to do that. So anyway, we've had every category of physician, from surgeons to veterinarians, healthcare professionals, all that sort of thing. So if you go on MedShopRx.com, I believe you'll see a microphone there. And you click on that microphone, and you can hear every program we've ever had. Our latest program is on bedbugs.
Wow.
Serious. The bedbug situation is really serious. So we had Mark, I can't remember his last name.
Adams.
Mark Adams, he's director of the Canton Health Department.
I was on that for 5.5 years. He's a sharp dude.
Yeah, he's a good guy. He's a very good radio guest. Very, very proficient in the subject. So that's a piece of the action. That's kind of who we are and what we do. And I'll let Brad maybe throw in a few more things here.
All right, well, I was making some notes as everybody was talking in the back, thinking about, honestly, I don't know how many of you even know what really we do in a pharmacy, or what a pharmacy technician might do. So I thought I'd take a minute to kind of cover a couple things. You know, I got into pharmacy basically in high school. My father ran a couple pharmacies. I couldn't do sports, I could do school. I liked math, I liked science, so I figured I like healthcare. I didn't want to go to school for the next 10 years to be a doctor, so I thought pharmacy was a nice compliment. At the time, pharmacy school was 5 years. Now it's 6 to 8, depending on where you look at. And not picking on any college in particular, I found Purdue and Indiana to be kind of a nice fit for me. But if you look at going to college for something like pharmacy, or you even look to a program to become a certified pharmacy technician, I don't want to sugarcoat it, so I'll just say it. Pharmacy is not like the high-stakes world of finance or law. It doesn't matter if you go to Toledo or Ohio State or Ohio Northern. When you get out, you have a license. And the employers are looking for a license. Not that they wouldn't be looking for experience that you could gain from an elite organization, but you don't need to spend $60,000 a year at XYZ school to get the same degree. You can go to another one and maybe spend 15 or 20. So keep in mind, there's not a whole lot of nobility and education in a pharmacy school with a big-time name and a big-time price tag, okay?
And some of those big timers have gone to 8 years, which
It's too long.
we both have a 5-year education, and there's the things that they've added to that curriculum are, I'm not going to say they're nonsensical. They're just not useful.
Sometimes schools are in the business to be a school.
Yeah.
Not picking on you guys, okay? But, you know, okay, so that being said, just try to compare all aspects. I do think, you know, I was lucky enough to go to Purdue, and it felt like a nice mix of Canton, Ohio, and maybe a little bit more of a city area. Whereas when I looked at Ohio State, it was just like way too much city for me. It just felt right. So don't discount things like that too. You know, we work in a retail environment, so it's not much different in the aspects of what you might go to shop at every day. The only difference is that sometimes we have our patients' lives in our hands. You know, people sometimes come in the pharmacy and they look at it like a fast food joint. They come up to the drive-up window, well, I don't understand why my prescription takes 15 minutes to fill. You just get it off the shelf and give it to me. But keep in mind that we really do hold patients' health and welfare in our hands, and if we're having a bad day and make a mistake, it could be fatal. So it's something to keep in mind that you're busy, we're busy, we're trying to use every tool at our advantage, whether it be technology or pharmacy technicians or barcodes even, to make sure we make correct decisions. And sometimes your insurance company is the biggest barrier to us giving you a pleasant experience in the pharmacy. A lot of times people don't want to come to a pharmacy. You guys probably like going to Best Buy or Target or somewhere fun, shop something fun. Most people don't want to go to a pharmacy. Most people who just got back from the doctor and found out they have diabetes or cancer, we might be the first people they see. So they come in with shell shock, hearing that they have this terrible condition, and then we try to help bridge the gap and give them some confidence that they can deal with it. So it's an environment where we can help. It's almost as rewarding to help patients solve their problems and get to know them and see them every day as it is to work with the people I work with. We haven't talked a whole lot about pharmacy technicians today. I guess I'd like to be the first to tell you that I cannot do my job without my pharmacy technicians. I would go to war for most of my pharmacy technicians. They make my pharmacy in New Philly what it is. I like to think that I have some good systems to help for organization, for rallying our culture, if you will, so that we can have people that work together well and work as a team. But we really are a unit that functions as one, and they complement me as much as I complement them. A typical day in the pharmacy, you know, Mondays are our busiest day. People usually call in their refills over the weekend. We, as a pharmacy, will fill prescriptions, and filling involves a lot of different things. You've got technicians that do everything from intake when people come into the store and hand you your bottle or paper, to data entry in the computers. And then after it's data entry in the computers, it goes to insurance companies and they decide what they will or won't pay for. A lot of times that involves another layer of troubleshooting and dealing with physicians and insurance companies and other organizations that help people get their medications paid for. And then when we fill them, it's either counted out of robotics like he described, or it's counted manually in our trays, bottled, labeled, and then the pharmacist will verify it and check for drug interactions and talk to patients about their file. Sometimes patients have questions and might be afraid to ask them. You know, don't ever be afraid to ask questions. Your mother probably told you the stupidest question not asked is, the stupidest question is the one you don't ask. You never know, okay? I mean, sometimes people take something as simple as a Tums antacid when their stomach feels sour, and they don't realize that that could totally invalidate the antibiotic they're taking to get over an infection. So, no question is a dumb one. Yes, ma'am?
Do you guys ever come across any patients that are addicted to the prescribed food?
Yeah, it's a problem, okay? Unfortunately, we're in an environment now where I don't want to, I'll be honest, I mean, when people bring in a prescription now for a pain medicine, unfortunately, we're almost conditioned now to think, is this legitimate use? It's a shame. There are physicians that sometimes we have to make sure that we are verifying the patient's diagnosis. There are sometimes patients that we have tools with the state of Ohio we have to use to verify they're not going to multiple doctors and multiple pharmacies. Unfortunately, they're making it harder for patients who really need these medications and pain to function. And it kind of goes back to some of the things that my father's always told me about. You know, you go to school, you get a license, whether it's a pharmacy technician or a pharmacist. Only you can lose your license. Okay, you have to think about, have I done everything according to laws in Ohio? Have I done everything that's ethical? Sometimes we have to refuse to fill a prescription. And you know, sometimes we have to use our professional judgment to make the best choice in theory for both us and the patient's welfare. And it's not always fun.
Here's what we're up against. Here's an excellent example of your question. About 3 years ago, we had a lady who we suspected was either trafficking in prescription drugs or was overusing them or whatever. So we did a little research and so called police. This lady had 28 doctors. She spent her entire week in doctor's offices getting prescriptions for
That's not
narcotics.
uncommon.
And not uncommon.
28's uncommon, but I mean, the doctor shop, they play tricks.
Yeah.
They prick their finger and put it in the urine to say they have a kidney stone. You wouldn't believe what they do.
You know what? Drugs are for sick people. You got to think that forever. What do we've got initiative on the Ohio ballot this November for marijuana. Whatever. It's absolutely, that's ridiculous.
Just to add to that,
Just ridiculous.
Even in the hospital setting, if they can't get to a doctor's office, especially on the weekend, we had situations where the same patient had been to 6 emergency rooms, Stark County, in the Akron area, all in one day. They go in, they go to the pain.
So you're a professional detective, a healthcare professional detective. And that's really, there are things in the pharmacy licensing and the pharmacy laws that says that you have to be able to exercise professional judgment. And what that is you have to be a detective. And how many times does this happen to us? Not necessarily the example I just gave you, but it's frequent. They modify the prescriptions, like they'll take a 2 and make an 8 out of it, or a 6 and make an 8 out of it, just to get pills. So.
Could I say something about that, Paul?
Sure.
When you have a cancer patient or somebody who really needs their medication, and you know there are other 3 or 4 doctors, I determine whether it's me or their primary doc who is the only doc of those 6 that is going to prescribe that narcotic.
Right.
The only one doctor.
We're seeing more and more of that, where they're teaming up, the doctors, and okay, you're going to do them, Dr. King. Nobody else is going to write these narcotics or these pain relievers, and that's really a good thing. So, go ahead.
Well, there's, not to be Debbie Downer, but there's tools in Ohio now where basically your doctor and your pharmacy can look you up and see every narcotic prescription you've gotten in the entire state, and it's expanding. There's probably 12 different states that are part of it now. So, you know what? There's so many cool things to go do. Don't waste your time looking for drugs. I don't know. It's a source of frustration. We do some things that are a little unique in the pharmacy world than what you might see at your normal Rite Aid or Drug Mart or whatnot. We actually make custom medications. So if you've ever known a parent that, God forbid, has had a premature baby, or maybe had a dog or cat that has a special need medically, we have the ability to custom make prescriptions in creams and gels and suppositories and lollipops and tablets and capsules and things that can help treat unique needs that big drug manufacturers don't make stuff for. At any given time, we probably have half a dozen kids that have come out of Akron Children's Hospital that either have a heart condition or maybe have some needs that, a lot of veterinarian companies make drugs for 50, 60, 100-pound dogs, but if you've got a 5-pound Chihuahua, there aren't always things that can help treat that body weight. So we make a lot of gels for cats that have thyroid issues. They put them on their ear because it's absorbed through the vascular pores in their ear. So it's kind of slick. We get to do some problem solving, work with patients who have kind of been to all these doctors that are desperate for a solution. So that can be nice. More on technicians. Some of our best pharmacy technicians we have had never worked in a pharmacy before. So don't let something like that, if it's an interest, turn you off. Some of my best pharmacy technicians were waiters and waitresses. I mean, they're used to a dynamic environment that's often changing. If you'd like to be on your feet all day, busy, dealing with people and in an environment that you do similar tasks every day, but is never the same every day. If have any budding drama people in here, we really should have a sitcom about a pharmacy environment. Why there's ER shows and Law and Order shows and no pharmacy show, I have no idea, because some of the things you see in here will blow your mind. But it's interesting. So.
Hey Brad, can you tell us a little more specifically about what a pharmacy technician do? And also, how long does it take you to become a technician as compared to a regular?
That's a good question. There's a couple of ways. As far as pharmacy technician requirements, state of Ohio requires you to either be a qualified pharmacy technician or a nationally certified pharmacy technician. So in the state of Ohio, unfortunately, we had a situation a couple of years ago where a mistake was made in a hospital in Akron, and as a result, you just can't go to the pharmacy and work as a technician anymore without one of these two things. So you have to be a high school graduate. A qualified pharmacy technician you can have that happen by getting a job at a pharmacy, and then after a defined period of time, you can take the company's Board of Pharmacy approved test to verify the skills that you've attained, and that is good enough. Another way to go is there's some places that have formal programs like Buckeye Career Center in New Philly, Brown Mackey up here in Canton. There's probably half a dozen more official certified pharmacy technician programs. They usually take between 1 and 2 years, and honestly, they can be pretty expensive. You might be able to do it by finding a job at a pharmacy, becoming qualified first at that company, and then being able to work with staff members there to help you with your education.
But you can basically go on the internet and take the test. You can get practice books and you can go on the internet and take the test. Some of them, I'm not gonna give you a name, but some of the trade schools are as high as $10,000 for this course. This course does not need to be $10,000. You can do it for very few dollars on the internet. You can take. I don't think you can take a test on the internet.
You have to still get physical.
Yeah,
you can schedule testing, but you have to go to like a Silver Learning
something
Center
like
type
that,
environment
and that's
to do
the
it.
nationally certified test. Okay.
So you can move anywhere.
We actually prefer to hire our own technicians and train them ourselves. We don't like to take them from the chain stores because then we got to re-educate them on
Bad habits.
Bad habits, how things are done, and all that sort of thing. So it's truly unfortunate that you cannot enter a pharmacy now, the dispensing area, until you're 18 years old. I'd love to give you. Years ago, we could give you a tour and really show you, what goes on in the course of the day, but we can't do that until you're 18. So you can look over the counter, I guess, in one of the drugstores and watch us that way. But some of those. Some of the trade schools are preying, I believe, on this particular course. A lot of them have gone away. There's only a couple, 2 or 3 left. Text today, if you look at your paperwork here, it's fairly accurate. What the printout here that Steve brought in the room. The certified pharmacy techs are in the 12 to, let's say, 1490, 1480, something like that range. And as a barometer, when I left my chain drugstore job as a pharmacist in 1976, I was making the huge salary of $18,000 a year. And I'm looking at this thing hanging on the ceiling back there, and I don't know, did anyone in this room know how to use that?
Good old days.
Not you, them. You know how to use that device hanging on the wall?
Yeah,
You know what it is?
What it is.
That yellow thing.
Oh, I thought you were talking about.
No, the yellow thing. You know what that is? Okay.
Well, that's the, yeah.
It's a slide rule, okay? And when I was in pharmacy school in the 60s, that was our brain, okay? Now, this is your brain.
Wait, is that the thing that like when you measure, like?
No, you can do all kinds of math calculations on that thing. They're not 100% accurate, but they're very, very close.
It's just like a calculator.
And if you didn't have that slide rule in the general chemistry test, you couldn't make it through the test because you had to use that to calculate your math formulas. Pharmacy is heavy math, okay? Very heavy math. Pharmacy curriculum is tough. It's not something you're gonna walk into the room or walk into college and slide through this baby. It's tough, and it gets tougher every day. So if you're not strong in math, if you're not strong in chemistry, and you're not strong in physics, probably not
Or at
worth it.
least like it and have it.
Yeah, at least like it and be able to, and be
So don't-
willing to learn it and study it. You're not gonna make it.
But you commented about what do pharmacy technicians do. For me, pharmacy technicians, it's kind of one of those things where we like to train people to do everything in the store so that everybody's cross-trained, if you will. So that's from taking out trash to sweeping carpet to data entry in computer for new prescriptions. That would be phone calls to and from patients and to and from doctors' offices on troubleshooting therapies and verifying orders. It would be checking an inventory that comes in on a daily basis from the medical drug wholesalers to filling and physically counting orders and preparing them for dispensing for the pharmacist to check. It would be ringing register and discussing with patients services that we offer. Our pharmacy technicians can demonstrate blood glucose monitors to help diabetes patients check blood sugars. I have a pharmacy technician who has extra certifications who helps me give flu and pneumonia vaccines. So we like to basically give you the opportunity to use all of the things that you would like to be able to use your education for. And again, I mean, I can't open my pharmacy without them, okay? I mean, it's something that on any given day, given the workstations we have in our pharmacy, it's a comfort zone would be really 3 to 4 technicians. On a busy day, 5 is ideal. And that's, so we have 2 pharmacists and 5 technicians and 4 or 5 phone lines and 2 cash registers and a drive-up window going. So I mean, it can be busy, you know, but it's engaging. And generally, you know, it's nice to be able to work with a group of people that respect each other and are friendly and enjoy being there. And you know, it's some of the people that you come across, you know, Steve mentioned medication reviews. You know, our industry is changing rapidly. We pretty much now still pay our bills by the fees that insurance companies pay us to dispense a prescription. But we're starting to have to embrace other forms of income to keep the lights on and the doors open and our staff paid. We're trying to get paid more now for medication reviews, which would be sitting down and discussing all your medications, finding problems if there are any, and helping you solve them. Working with your doctor to get that done. There's vaccinations that we do now, and I expect now, since as of a month or 2 ago in Ohio, we're technically allowed to give any vaccine that the CDC or Centers for Disease Control recommends. So I have a feeling before the next 10 years is out that you're going to be going to your pharmacy for all your vaccines, and your doctor's going to probably not be doing a whole lot because it's getting harder for doctors to do those things and get paid for it.
Get used to babies crying, because I think it's gonna happen.
Yeah.
You mentioned that technicians do a lot more than count, pack, and label, but what do they generally make, a range of income versus most pharmacists, retail and not? I mean, is there a difference?
I don't know. I mean, he's got some data in their sheet here. You know, pharmacy technicians can be across the board based on your experience. If you're new or veteran, from minimum wage to maybe 15 or 16 bucks an hour, depending on what the options are. If you're specialized in like the sterile compounding thing, it could be over 20.
We bring them in, no experience, no training, like a waitress or something, at $9, okay? If they have any other ancillary skills other than non-pharmacy related to medicine, we'll go to 10. But we have techs everywhere from 12 to 15, $16 an hour. And it just depends upon their skill level and what they do within the business. Technicians need to be leaders. That's a piece of the action as far as raises go. Pharmacists need to be leaders, okay? You're running a business, you're running a pharmacy, and you're trying to keep everybody in that pharmacy in a working together mode. And Steve and I were talking about this, I think, before the program today. Was that if you're not working together in an environment like that, or for that matter in any environment, you're not going anywhere. the business isn't going anywhere, so.
Would you say with the hospital pharmacy, you need to also have relationships with the doctors and nurses and administrators within
Yeah,
the organization?
Going back to what Brad was saying, what technicians do, basically, they do everything that the pharmacists used to do 20 years ago. I can tell you, 20 years ago, the only thing that technicians were allowed to do is type labels and put them on the bottles and count the bills. Even the pharmacists had to count the bills if you go back that far. Right now, all that's delegated to the pharmacists in a hospital setting, when all the pharmacists are responsible to do is to enter that order in the computer system and ensure that is the appropriate drug, the appropriate dose for that patient. Everything else the technicians do. They make the IV infusions, or they work in the IV room exclusively. You never see a pharmacist unless it's a really complicated IV admixture. Even chemotherapy infusions, the technicians do. So their roles have really expanded. They apply the labels in the packages, they get all the medications ready for the pharmacist to check. All the work has to be verified by pharmacists nowadays. So really the responsibilities of role have expanded so much so where some of the things they're doing today are the things that used to be done by pharmacists. This has freed up pharmacists in a hospital setting to do the other things that I mentioned, to do medication reconciliations, to run with physicians, to interact with nurses, to educate patients and families about their medications, and also to make an all-out effort to for those medications to be safe and effective for the patient, for the benefit of the patient in the hospital and when they leave the hospital and they go home, to make sure that they don't return back to the hospital because of the problems with their medications. So basically that's what happens. Now as far as money goes in the hospital, because the roles are expanded, because they work second shift and night shift, and there's, I know our techs on night shift, we used to pay them $2 more or $3 more now than on day shift, and second shift from 4 to midnight the same way. So the range in the hospital, I would say they were making anywhere from $15 to $20 an hour, with the average about 17, which would bring in about $34,000 to $35,000 a year for the pharmacy.
Akron Children's for the midnight shift is paying $16.50 now.
$16.50
for techs.
Yeah, so that's
Plus benefits, I mean, there's a complete raft of benefits.
So that's about, and you know, it depends on longevity. If you're a new, they have rates, and if you're the new vet, you often start at the bottom, and after 5 years, you make more and more and more. You keep going up so much every year until you go to the top step, where that pays the most. But I can tell you one thing, for the amount of time that it takes to become a technician, that's not bad. Because again, like Brad said, all you need is a high school education or equivalent high school education. And if you're smart enough, you can get on the internet and study. There's courses, and all you have to do is take the national board, technician board certification test, and there's a test that Ohio Board of Pharmacy offers as well, and you can become certified. Now, you're allowed to walk in that pharmacy and get a job if they're willing to hire you.
You can make money and maybe help pay for your tuition at pharmacy.
I think most of the students here are going on and continuing their education.
Right.
So, yeah.
And in the last, I think in one of the last studies we did nationally, pharmacists are the #1 respected profession.
And that says a lot, you know.
When you said, you know, they're coming to you and your advice is free, I think they're coming to you because of your expertise. You know, that's my observation. People know you know more than the physicians.
Well, I don't know about that part, but no more than physicians.
Well,
More accessible.
you know,
Yeah, we're more accessible, I think is easiest, and we're the next line below the doctor, you know.
Probably get to talk to us more than they talk to the
Yeah.
doctor too, given how oftentimes you get 10 or 15 minutes and then
I don't think that's what happens. Patients and the public, they're more comfortable talking with pharmacists
Yeah.
because they know they're more accessible.
And your expertise, you know. My dad was a retail pharmacist, he managed a drugstore for 18 years, and he was a hospital, director of a hospital pharmacy for about 12 years in his career. And everybody in our family worked in pharmacies.
Well,
So,
yeah.
you know, yeah.
Well, not to knock any doctors, and to expand on that, for example, take Dr. King, he's a specialist in gastroenterology. He knows all the drugs that he uses in that field extremely well, much better than I do, because he has the experience in knowing how. But pharmacists know generally more about other drugs because of all the classes of drugs. And especially the physicians in a specialty, they really know the drugs well. You know, nobody can argue that, right? Dr.
Yeah,
King?
I'd like to say that although I do, I keep up to date, even now that I'm retired here, so I keep up to date on all the new drugs and so forth. But I use the pharmacists throughout the years as a consultant too. They consult me, I consult them. Here's another very important point. You have to talk often with the families. The pharmacist does and I do. Because you're assuming that that patient knows what you're saying and they're comprehending it and they're gonna take it like that. Well, hell, it doesn't work that way. Because if you talk to the doctor, say, oh, doctor, you'll be lucky if she takes that once a week. So, and I remember one time in Mercy, I was scoping a bleeder, she was bleeding like crazy, and a 72-year-old Italian lady, blood all over the wall and everything. And that's from varicose veins, esophageal varices here, you know. It usually happened when I wore white shoes and a white outfit. Anyway, I was talking to the daughters, or I talked to the woman, and I said, do you drink it? I said, no, just a little wine with supper. So I talked to the daughter, says, oh, doctor, those are tumblers. She was drinking a glass of wine like this, and she had liver disease and portal hypertension, so she, you know, I mean, she says, well, she didn't drink. But the daughter says, oh, doctor, that's not a little glass of wine, she's drinking tumblers. That's a glass that big.
Just to tell you the magnitude, and that's in the statistics that I passed out today, 50% of all people take at least one medication, and 1 in 5 take 3 or more. So, I mean, that tells you the extent of the scope here of being able to provide those medications efficiently and effectively and safely to those patients. And that's where really pharmacists come in, because that's growing. As people live longer, and all these disease states that are confronted with really increase as they live longer, then they need more medications to keep going. I know my dad is 97, he's 97, yeah, and he's about 10 different medications, and my mom is 98. And I would have to say, without those medications, they wouldn't be alive.
Well, that's
She's
what-
about 10 different medications.
That's helping people get older and older, but as you get older and older, it's all spills, pills, and bills. You break the hip, you break this, and more pills. And for falls are the biggest thing. And in the house, I tell people, have night lights everywhere, everywhere. And if that driveway, if you gotta take your garbage down there, I use the car if there's ice or snow there, I'm gonna take a chance. Just a second, you got a serious thing here or here. And if you got this, then you got a big spot to your lungs and bye-bye. You know, and that's the way a lot of people check out. So it's real important stuff. Anyway, I got these Neomed programs here. You're welcome to take them. This has to do with medicine, pharmacy, and research.
And their program, Neomed's program is accelerated. I believe they go year-round. And the traditional Ohio pharmacy course is 6 years, but I think theirs is 5. They should do the year-round. So, unlike, I think they're unusual in Ohio. I don't think any other house schools like that.
Okay. I'd like to thank all three of these gentlemen for coming this afternoon.
I would too. I think you really captured, you know, how complex, you know, the different work opportunities. I mean, you know, hospital pharmacy versus retail. and really gave them a comprehensive picture of so many things to think about, you know, personality-wise, and
You can be a tech, you get a feel for pharmacy, you go on pharmacy.
it makes me want to go back.
All right.
Thank you all.
Thanks.
Ladies, right up here.
I enjoy it.
All right, Terry, take care of yourself. I don't want to see you head on the highway. All right, we can do that, I don't want to